Susan is okay to do that, to give us a quick update from a public health perspective, and then just to get a lay of the land about what you're seeing from each of your sectors. Again, that real-time input and perspective would be really valuable for me at this point. And then we can have a discussion from there, if that's okay. So Susan, if it's okay, I think just given the current state of the union with COVID, I'm wondering if you could kind of kick things off with maybe just a bit of an update about what you're seeing, and then maybe if we can just field any questions from there, and then maybe we can do a roundtable from everybody else, if that's okay.
Sure. Good morning, everyone. I wish I had a better update to share and more positive news, but we currently have over 400 cases. We had a record high number yesterday with over 100 cases, and this morning at our 8:30 meeting, we already have 57 in the queue. So we are trending upwards in terms of cases. We do have Omicron, the new variant in our community. So we've had that genome sequencing testing back so that we know that's in the community, and it is spreading. We currently are doing our best to do case and contact management, but we've had to bring in the provincial workforce to help us with that. The number of cases have simply overwhelmed our local capacity to manage this locally. We are increasing our vaccine clinics as much as our capacity allows. Like everyone, we're having difficulty with staff absenteeism and also with recruiting other staff to help with our clinics. But yesterday we did over 2,000 doses of vaccine. 40% of those who are eligible for their third doses have taken it already, and 35% of 5 to 11-year-olds are vaccinated with their first dose already. So we're making good headway on vaccines, but right now that's not enough. What we really need to do is to remind everybody about the other public health measures and not relying solely on vaccine status. We still need to mask, we still need to physically distance, we still need to, clean our hands. If you're sick, you need to stay home. We're seeing a lot in the schools. We changed our screening criteria to a single symptom criteria. We did that a number of weeks ago because what we saw was that a number of the cases in the schools started with just one symptom and often a runny nose. So that's what we were seeing in school. So we did a one symptom screening tool. In terms of testing, it's very difficult for our testing centers to keep up with demand. And same with our lab. We've, for the most part, for this pandemic, we've been receiving testing results within 24 hours from our local lab. They've been doing wonderful work, but there's a volume effect. And so now we're getting some of the test results back a little bit later than that. In terms of other things, we're looking at the epidemiology of how these things are spreading. As you know, there's been a number of community outbreaks. Recently, we just put something out yesterday about alehouse. So we will be looking at, we're currently examining what we're seeing in terms of spread. And Dr. Oglaza is reviewing that, and we'll be looking at whether or not there's any further restrictions that we would be implementing to address the type of spread that we're seeing locally. And currently those are under legal review. And I think I'll maybe just leave it there and see if there's any questions anybody has.
Okay, thank you. Thanks for that update, Susan. Are there any questions?
Could I please?
Yeah, Dan, go ahead.
Good morning. Susan, do you have a sense about what percentage of the cases are with unvaccinated versus vaccinated? And I'm looking for more energy to support the vaccination process with our workforce.
That's a great question, Dan, because sometimes what people will see is, there's 100 new cases and 50 were vaccinated and 50 were unvaccinated. And so then people assume, well, I have an equal risk. Right? That's what,
Yeah,
and so
yeah.
why should I get vaccinated?
Yeah.
But the truth of the matter is, you're drawing from very different pools. So, to pick a fiction example, so you have 100 people who aren't vaccinated and 50 of them get sick with COVID. And then you have, 100,000 people who are vaccinated and 50 people get sick with COVID. So what we're seeing is that the risk, which is what you really need to pay attention to, is much higher for people who are not vaccinated. If you go on to, I think it's on Twitter under Ask the MOH, Dr. Oglaza did a really good description of risk, and he used some actual numbers, and that was about 2 weeks ago. And at that point, you were 5.5 times more likely or at higher risk of getting COVID if you were unvaccinated. I don't know what that number is today, but it's much higher.
Thank you. That helps.
Yeah.
Thank
And
you.
the other thing I'd like to mention is sometimes you'll hear about people who are hospitalized who are vaccinated. And so again, it doesn't protect you. But the reality is lots of people who are double vaccinated who are hospitalized, their health was compromised. And so people have lots of chronic conditions who are being hospitalized, who are vaccinated as well.
When you just said there that being vaccinated doesn't protect you, that's not what I understood. What I understood is being vaccinated increases your chances of not getting seriously ill.
Oh, so thank you. Let me just be a little bit more clear, because clearly no. If you get vaccinated, your chances of becoming severely ill are drastically reduced.
Thank
so
you.
being vaccinated is a good thing. Yeah. But sometimes people will see somebody in the hospital who's been double vaccinated and they'll say, oh, I guess it doesn't protect me. And that's not true at all.
Agreed.
Those people had more protection than they would have had otherwise. But often the people who are vaccinated in hospital had very compromised health to start with.
Perfect. Thank you.
That's great. Thanks, Dan and Susan. Are there any other questions at this point for Susan? Susan, I have a question. So when Dr. Oglaza was speaking to council this week, he talked about how the approach that public health is taking right now is essentially to do a couple of goals. Number one is to try to keep schools and workplaces open. And then the second piece is just to try to manage and preserve hospital capacity. And I'm curious to know, is that talking about local hospital capacity, or is that seen at a provincial level when it comes to hospital capacity? I know that yesterday, for example, KHSC talked about how they were having to transfer some patients to other hospitals as well. And so do you have a sense of where that conversation is at and how we're feeling about hospital capacity and how to frame and how to message that when it comes to that question?
That's a great question. So a lot of those discussions are happening here locally, because what we're seeing locally is that the fourth wave is much worse in KFLNA than it is for the province. The province is going up steadily but slowly, and it's not seeing the spike that we're seeing locally here. So in terms of the impact on our local hospital, we are already in a situation where we are sending some patients to other hospitals, and other hospitals have the capacity to pick that up. So part of that is a local conversation and making sure that we're preserving, our hospital capacity to manage all of the conditions that hospitals have to manage in addition to COVID. I would suspect that those conversations are always happening at the provincial level. But I'm not part of those conversations, but I would hazard a guess that Kieran is always going to be keeping an eye on what's happening in hospitals to make sure that as a province, we're preserving the hospital capacity. Because if something happens locally, like happening with us, and other hospitals have capacity, it's not ideal, but people can still receive the care that they need. It's when all the hospitals start reaching capacity, I think that's when that's what people are concerned about. So it's always going to be monitored at a provincial level, but lots of the discussions are local.
No, that's helpful. Thanks for that, Susan. Okay, so if it's all right with folks, I wouldn't mind just doing a bit of a roundtable at this point, just to get a lens of what you're seeing in your sector. what we're seeing with, for example, community confidence levels, just given the spike in COVID that we're seeing, and anything else that you think should be on my radar at this point, is obviously I'm having conversations now with Dr. Oglass and with other folks as well about what we need to have at top of mind right now. So I am on my phone, and so I'm scrolling back and forth. And so if I miss a hand or miss anything, then please be patient. I'm just want to make sure I don't miss anybody. But maybe if we could maybe start with Tim. Tim, if you're there, can you give us a sense of how are things going? What are you seeing? What's the outlook right now in the restaurant sector?
I guess uncertainty will be the key word. So we're expecting, as Susan mentioned, an announcement regarding perhaps further restrictions. We don't know if that's going to apply to restaurant capacity or not. Obviously, since rates have been going up, we've seen business going down. I think anyone I've spoken to has seen a fairly dramatic drop in business over the past several weeks. On the labor shortage front, things seem to be getting a little bit better. At least they are for our businesses. We've had more applicants lately. I think that might coincide with some of the subsidies tailing off, but so that is getting a little bit better. But again, we're just sort of waiting to hear what's going to happen next. The other uncertainty is with the supports from the federal government. A lot of businesses are no longer qualifying under the new tourism and hospitality funds, but I think there is some possibilities that might change and become a little more open, hopefully. If things continue in this direction, we're definitely going to need help. Again, pretty much I think about 90% of restaurants have relied on the wage subsidies and the rent reductions. And if we see further restrictions and further closures and less income, we're going to have to continue to rely on that. So again, back to my first word, uncertainty. We just don't know what the next few months are going to bring.
Yeah, thanks, Tim. I hear you. I hear you on that. If you had to attach a number, like a percentage change in, for example, like the amount of business, right, that you would have seen, like so a drop in the last number of weeks, could you give a range or kind of quantify that for me, or is it too hard to do that?
Kind of hard. It's different with every location, but at least we can say that I mean, normally we do see a drop in November, but as the cases go up, I'd say like 20-30% down from normal.
Okay. No, that's thanks, Tim. It just gives me a bit of a ballpark just to look at, and I hear your point on uncertainty and how difficult it is to plan with that. So I am having a conversation with Dr. Oglass later on today and hope to get some sort of sense of lay of the land about exactly what those restrictions are. I know that at our council meeting on Tuesday, there was certainly still very much a focus on targeted restrictions that would try to address the spread as much as possible. And so there was, for example, some comments made about potentially about requiring symptom checklist to make sure that people with symptoms aren't necessarily going out into different locations. So that's just something that Dr. Oglass mentioned might be a possibility, but hopefully we'll have a little bit more ideas and indication on that shortly.
Good, yeah, and I think a lot of at least our locations and a lot of restaurants are still actively screening guests for symptoms, and there's some great apps for that now, so it's quite easy to do, and I think we're all sort of keeping with our protocols as much as possible. So, for sure,
no, that's great. No, thanks, Tim. I mean, I think you're right. There's a whole range of best practices, and so maybe it's mandating some of those best practices for sure.
Yeah.
Okay. Next on my screen is Trish. Trish, how are you doing? How are things looking in the cultural sector these days?
Well, audiences are very happy to be back. We talk about community wellness and cohesion, and to have that social time again, and just to have that beautiful exchange that happens between the artists and the audiences. I know at the Isabel, even though we fought hard to get up to 50%, and the current ruling is 100%, but we've actually kept ours at 40%. So we've got a checkerboard, so there's no person in front or beside people, and we have no intermissions and no drinking. So basically, the masks cannot come off. So that. If you're thinking about restrictions, maybe not just a binary open, close the arts, but look at the restrictions of containment, which is keeping masks on. And I know, there's different practices across the city in terms of having drinking at and food at concerts and also at sports events, but just kind of look maybe more holistically at trying to continue the business, but doing it as safely as possible. It's just, it's wonderful to be also starting to envision 22, 23, rather than planning in quadmesters. It's usually you launch your whole season, but here we're launching, here's the next few months, here's the next few months. But to be able to visualize 22, 23 is just really exciting. The arts are still suffering because the fees are still lower for artists because of the capacities, and as well not being able to have that big subscription base. It's still a struggling time for the arts, and as we know, the arts were one of the hardest hit sectors during COVID. So let's try to figure out safe ways to continue arts activity as we go forward together.
Thanks, Trish. No, that's really helpful. And yes, I know that is a suggestion that I've heard, is if there were further restrictions, something along those lines, that rather than looking at capacity limits, that basically, mandating that, if you're in an indoor space, your mask has to stay on the whole time, for example. So that's helpful.
And without intermissions, we actually stagger people coming in, so there's no gathering and no masks off, and that so far. And you'd asked about community confidence. And so we're seeing people coming back, but because we're not at 100%, people are actually feeling safe coming in. So there's being safe and feeling safe, and having that ability to have a bit of space around people has actually been really helpful. And we've heard that from our patrons.
Okay.
As well as the strict screening. They feel really great. We thought we were going to get pushback from the strict screening. We get great comments saying, I'm so glad you're doing that.
That's great. That's great feedback, Trish. Thank you. Thanks for sharing that. Perfect. Pavna, I see you next on my screen. How are you doing? How are our nonprofits and social service agencies holding up, again, where you've got this collision of a whole bunch of factors all kind of happening at the same time? How's the sector doing, and what are you seeing from your perspective?
Well, I'll start with something non-COVID and good news to start with. So the Community Food Redistribution Warehouse, the location has been set. It's 785 Princess, which is when you come off of Sir John A, you go into that space at the back. It's wonderful. We had a quick tour yesterday, and it is really going to be amazing. It's going to have space for trucks to back right in, which no one has right now, so you can receive large donations of food. It's going to have a space where you can wash vegetables on the ground, the root vegetables. It's got space for lots of skids, so all these large donations that we've been receiving can be well stacked. It's it's space for volunteers. It's got some amazing, it's really coming along well, and we will have an official opening when it's more developed, but right now we just got a sneak peek ahead of time. So that was great news. The other thing is we have started a Homelessness Collective Impact Committee, and Susan and I kind of co-chair it, just co-facilitate really, because we've got a really great wealth of people on it with lots of different experiences. There are 4 key issues that we're looking at. One is, of course, the immediacy of what we need in the city. It's been great working with the city, so many different departments working together. In the United Way, we're working with agencies, and we're close to, we cannot announce the location yet, but we are looking at a place for where we can start serving evening meals, just as Lionhearts did and Street Mission did at stages. So that's coming up very soon. And hopefully we'll also be able to build that into a warming center. So kind of a lot of collaboration happening there. And I know we're just waiting for some legal and other information to be closed before we can actually announce, but it's very near, and we're very excited about it. And again, kudos to your team, Lanny. A lot of hard work has gone into it. And I know our team at the United Way has also been working closely with all of you. The other one that we're looking at is discharge planning, just looking at better ways to manage discharges from corrections and healthcare, because we know that that certainly adds a burden to our social service system, so to speak. And so we're trying to find ways to smooth that process and find better ways to be more prepared and be a little more proactive. That's going to be a longer term kind of goal, but we'll start with the immediate. And I think working closely with healthcare, with ICH and social services and healthcare working together, and public health, it's given us a much better understanding of some of the constraints and the challenges and the opportunities. So certainly that's something we're looking at. The other one is shortage of staff, and I know everyone is seeing that, but I think some of the things that have bubbled to the surface is, firstly, we're working closely with Queens to find volunteer and placement opportunities. We're also going to work closely with St. Lawrence College about, again, how we can get more practicums as part of workforce development. I know Craig's excited to hear that word. We're also looking at ways to, how can we help students be on the ground ready, because we need people to be ready to jump in, and some of the complexity of the issues that agencies are facing. It's pretty petrifying for people with experience, and it's challenging for people who are straight out of school. So how can we get them, prepared and ready and really able to succeed in the career of their choice? So that's something that we're working on. Obviously, there's a lot of burnout. It's been a long period of time and people are exhausted, similar to healthcare workers. The one thing that has come to the surface is how poorly paid a lot of the staff are in the social services. And as a result, some of them they can find a better job with benefits in retail. And why would they put up with this kind of risk and stress? And not that retail jobs are not stressful, but just, it's giving them an alternative rather than having to deal with the complexity and shifts that social services workers often have to do. So that's another area that we probably need to look at. And we as funders need to certainly acknowledge that and find better ways to support them on this. And again, there's some agencies that are not government funding, and they're particularly stretched for something like this. So we have to look at a more equitable way to help these amazing people who work. And again, a hats off with the situation on hand. We have been really fortunate with working closely with public health, and the agencies have been so wonderful and collaborative that we've actually held off for the longest time on any pandemic outbreaks within. But of course, now with the community spread, we are seeing some of it. And we have, as you likely know, a situation response team that meets every day to kind of work through, and the two different teams working. One is the direct client service, and the other one is more looking at other issues and how we can get meals and volunteers and what resources are required. It's a tough challenge. It's not unique to Kingston. Every community we've talked to is experiencing this surge. Likely, what we've identified, there is a drug poisoning crisis. There is a lack of affordable housing. There is a lack of shelter space has constrained due to the pandemic, so we don't have as many shelter beds. So a lot of factors are coming together. But again, cannot say enough about the staff and volunteers and everyone who's looking at, who's working closely together. But a lot of strain on the system, and it doesn't look like it's going away for a while.
Thanks, Bhavna. No, that's a great update, and kudos to you and everybody that's been involved in this sphere. It's been a lot of teamwork, but as you say, the challenges are immense right now, for sure, and I appreciate that. Thank you. Okay, next on my screen is Abba. Abba, how are you doing? How are things going? What are you seeing? From personal services, what's going on with confidence? Customer traffic. Any other perspectives that you can share with me?
Sure. Morning, everybody. I guess similar to Tim, obviously, we can echo very much concern of people. I think there's a lot of frustration. If I had to give a lot of words, it would be frustration would be one. In terms of, for example, we, similar to Susan, have very stringent like COVID screening forms. Sometimes we have clients who get frustrated because they're like, we do it all the time. And we're like, we know, but we have to keep doing it. But also frustration now with like, the new stipulation. So every time one of my staff members comes in with a runny nose, they have to get tested. And so not only that, it's testing times, waiting times. So, especially now with an increase in people, the chance that somebody maybe just has sinuses or cold, but we're still making them get tested. By the time they book into a test, maybe that's 3 days later. By the time they get the results for the test, that's 5 days later. And we are a very front-facing business. So that's 5 days that we have people out and have to rearrange clients or rearrange schedules or vice versa. And so for us, it's very difficult to plan or to schedule anything just because we're either waiting on people to get test results. We have people shifting because they don't know what to do. The information that everybody's getting is very different depending on the circumstances from public health in terms of like at the beginning, if you were double vaccinated and you had a negative test and your symptoms reduced, you can come to work. Now I saw last night with the new regulations, if you have the new strain, even if you're double vaccinated, then you can be out of work for 7 days. And so it's just very challenging to kind of run a business that requires people scheduling appointments and showing up, given that there's so many factors at play and so many things that can happen and, not really sure how to do that. And then just, concern with staff in terms of like, suppose someone is double vaccinated, but they're not showing symptoms, like, what do we do services? Because we can't really screen on them. So there's a lot of trepidation on both sides. I would say we still have people who are coming in because they have come in and they see like the processes that we are doing. But I would also say we've had a large amount of cancellations or people rebooking because they're also monitoring what's happening with the cases in Kingston. And then getting the messaging that if you can stay home and work, stay home and work. So then that loses any foot traffic, anybody who would come from an office. And so all these things are really impacting anybody who has a front-facing personal type service. How are they supposed to, in the busiest season, be able to kind of, get foot traffic that they would normally, bank on, given all the messaging and the things that are happening. And so it's just a very frustrating and challenging time. And then obviously, like economically, like we don't have any personal care services lobbying group. And so for us, even some of these, so I put up that business recovery program, it doesn't even quite work because we were either shut down for some of the periods. So we're comparing it to a period where we were shut down. So then we don't get the funding because obviously now we had something, or we're comparing it to periods like in the summer where we were all busy. And so now we're not busy, but now we wouldn't qualify because the time that we were busy is being knocked against us. So it's just like a lose-lose situation in that respect. With that being said, though, I think people who are coming in are happy when they do come in. They like what is being done. And staff and people are trying to be positive, but I feel like everyone is just done. Like they're burnt out on a level of like, I can't do this kind of round again of like, and not knowing what is the goal or the end. And I think that's kind of the frustration. I think if people knew like, this is what we were trying to get to, or this is where we'll be going, but I think there's a bit of fatigue all around. And so just trying to do the best that we can do and hoping to like get through December and just knowing that probably January, February, is going to be a very interesting period for us. If it is that we can't get subsidies and if it is that people aren't feeling comfortable coming out, that we have to be very strategic as to how we can retain staff, how we can keep doors open, how we can pay rent. And so that's kind of just the overall, I think, feeling that I have my notes on. So yeah. And in terms of like even what to do, if we have to reduce services where people have to wear masks, that's again, reducing a lot of the services that bring in the most income for many spas. So you're taking away facials, you're taking away things and services that kind of generate that. People aren't really doing leg waxing in January. And so therefore, like you have very limited services that you can offer. So it's almost better to not be open, but not that, but I mean, you're not going to get that traffic or anything really being booked if you kind of start limiting these services that they can do as well. And so I just think looking for a hopeful kind of what is the, what can we look forward to, or what is the hope that there is so that we can also like, keep our staff buoyant, keep ourselves buoyant, and assure our customers that here's the plan moving forward, so that if you do decide to do this is how we can kind of support in that way.
No, that's great feedback, Ava. Thank you for that. And yeah, your point about just impacts on personal services, that's exactly the kind of input that I'm looking for. Certainly when, so that can be raised, right, when we're having discussions about what potential new restrictions might look like. So thank you for that. Maybe Susan, if I could just go back to you for a minute, because to the comment about wait times for testing, because I know that there is a real push now, obviously, to get as many people tested as possible, especially with case rates going up. I think that there's an even greater demand for it. Do you have any sense about like just capacity and any sense of if that capacity is there, or are there plans to be able to try to address that? I know that that's been something that you guys have been working on. Just like to hear where things are at there.
Right. So we're having discussions with Kingston Health Sciences Center. They run the assessment center, and working with them to see about expanding hours and making it more accessible to people. Public health, we are doing some testing. We are doing some mobile testing. So for difficult to reach populations, we have a city bus, and I guess the city have been, phenomenal partners throughout this whole pandemic. And we're doing some mobile testing. We're taking vaccine with us. So I can't comment on what specifically is happening because it's not our organization, but certainly we're having conversations with them. I won't say daily, but well, maybe daily, about how we're going to work together to get as much testing as we can in the community.
Okay, that's great. No, thanks, Susan. I appreciate the input on that piece. Okay, looking at my screen, the next person I see is Dan. Dan, how are you doing? How are things in construction these days?
We continue to be so thankful to be outside for the most part. I mean, on a cold, snowy day like yesterday, you might argue that it sucks, but the reality is we're able to be outside, and that keeps us a whole lot more comfortable with the situation than being in a restaurant or in a healthcare or personal services like Abba was speaking about. So for that, we're thankful. There continues to be very selfishly money's being spent on infrastructure, which is important as well. So I have to say that for the most part, we're good. I think the reality, certainly for me very personally, is trying to help our workforce manage the fear. And I'm afraid that, and it's such a difficult conversation because we're also very afraid of everything that my wife was at the mall yesterday, and she said there was nobody there. And a week ago, the place was like 75% full. So people are so fearful that they're just uncomfortable doing anything. They're uncomfortable going to Tim's restaurants, or uncomfortable coming to Abbott's place for personal care services. And it just goes on, and if there was something that could be helped, I think it would be some antidote to help people respect their fears, because while the virus is serious and their case counts are up and people can get terribly sick, we do have to manage our fears, and that's a conversation I just seem to have daily with our workforce, and it's hard to tell people not to be afraid and it not come across as being disrespectful of the significance of the virus. So that's the biggest challenge.
Yeah, no, that's a great point, Dan, and I would agree. I see that as well, and it's crafting the messaging in the right way to, on the one hand, what we need to do as a community, but also trying to put risk in perspective, particularly for, when you are vaccinated. No question about that.
Exactly.
Thanks, Dan. No, that's really helpful. So I was wondering if we could also just hear from, see Allison and Mary Jo and Karen on the call as well. Would love to just get your perspectives as well from each of your lenses about what you're hearing, and be able to confirm maybe what we've heard, or even just to bring other thoughts or ideas to the table. So Mary Jo, I see you first on my screen. How are things in the downtown? What are you hearing? Any additional thoughts, perspectives, anything that should be on my radar at this point?
I think Abba and Tim summed it up much more accurately than I ever could. I would say personally, with the interactions that I've had with members, there's definitely a heightened degree of stress showing in, and it's not necessarily in the conversation that we're having, it's just in life in general, trying to balance all the things that Abba and Tim were talking about. So I can't answer better than they could. I can answer for us being an office that used to have 4 people and now we're up to 8 plus 2 street crew plus people coming to pick up gift cards, that we have had to buckle down and get very serious about the protocol that we have here. So we are now sending people home if they have a sniffle. We've gone through 2 rounds of that. Thankfully, they were both negative. We are now have 2 people working from home and everybody else with the permission to work from home or a hybrid model. And we're encouraging, as of yesterday evening, I think you'll start to see a lot more rhetoric on our channels about buying the downtown dollars. The campaign is super successful again, but it does bring traffic through our office. So we're starting to promote asking people to purchase online before they come, and just cuts somebody's stay down from 10 minutes to a minute or 2. And then the main focus that we have at the office is trying to make sure that we're still bringing people downtown without putting them in precarious positions when it comes to COVID. So C'est l'hiver programming is very much geared towards trying to increase foot traffic with the hope that those individuals will be able to make conscious choices. I would say that the pedestrian counts, or noticeable pedestrians have gone down this week, but I wouldn't blame it as much on COVID as I would just very precarious weather. In fact, one of our very busy stores closed yesterday at 5 when they're normally open till 9 because it was just a dead day. So I'm not hearing so much about COVID, just hearing more about that kind of stuff this week. And then finally, we just installed a pedestrian counter on our corner for the first time, which is digital, which allows me to track by the minute our pedestrian count. So we'll have a good idea of when things are going up and down in a couple of months when we have a little bit of tracking history on that. So I'm super excited about that. It only gives us our corner for now, but it's a bit of a pilot project to do the entire downtown.
That's great. Thanks, Mary Jo. And yeah, that information on pedestrian counts, that was interesting because to Dan's comment about what he saw at the mall, I was curious to know what was happening with foot traffic. Like you said, weather would have a role in that as well. So thank you. That's helpful. Allison, maybe I'll go over to you next. Would love to just hear what you're seeing, both from like the accommodation sector, hotels, and just tourism in general at this point.
Yeah, for sure. I can start by maybe reflecting on the fall a little bit, the last couple of months, just to give people a sense of where things are. I'm sorry, I'm going to look down because I made notes so that I would get the information correct. So, September, October, November, in terms of occupancy, which is a sort of key indicator for us for tourism, was fairly strong, to be honest. So September came in around 77%, which was actually higher than 2019 numbers. October 66, November 56, which both of those are within a few percentage points of 2019. So we were hearing from our partners until recently that, it had been quite a good fall for them and that they were, at least on the leisure side of travel, feeling pretty optimistic or thankful of, what the last few months have been. Still seeing that Toronto, Ottawa, Montreal are our primary markets, which, we're usually a drive traffic city. So that makes sense. And that's also where we were marketing, sort of the idea that Kingston's a nearby place to visit and trying to leverage staycation messaging. We saw some return of sport travel in November. So we had, rugby, basketball, I think, cross country, and also the rivalry series of Canada versus US women's hockey at the Leon Center. And all of those came to fruition through the sales team at Tourism Kingston. So they were glad to see some return of that. Definitely on the business event side, that's really along the sport what supports low season tourism, and that's still where the concern is. We're not seeing a return to business events, and I certainly think the current situation with COVID numbers increasing will only restrict that further, I imagine. Definitely our sales team is having conversations with people, but the planning is quite far out. So it's into 2022 or into the later part of 2022. It's not, first quarter or second quarter. So from our perspective, I mean, it definitely feels like the way people are feeling has shifted pretty dramatically just in the last 10 to 14 days. We had a marketing committee meeting not too many weeks ago, and people were feeling pretty positive going into the winter, that at least given all things considered with COVID, that, things had improved. And that's not the sentiment. I think people are just really unsure if we're going to be facing lockdowns, like we did December, January of last year. Or I also know, there's been some mention of our focus on social gatherings in private homes. And so does that mean that's where the restrictions are going to be less so on businesses? There's just a lot of uncertainty, which was echoed around the group this morning.
Thanks, Allison. No, I would agree. And your description of the sentiment changing over the last 10 to 14 days, I think is that encapsulates things perfectly. And I get the uncertainty piece. That's tough. It's tough to plan and know exactly what we're looking at here. But thank you. That update on tourism piece was really helpful. And like you said, the fall was actually was pretty good. So hopefully we'll get through this wave as quickly as we can and look forward to stronger days ahead.
Yeah, I will. If I can just add, I will say that on the leisure side for marketing, we're continuing, to plan based on things staying open, because that's the information we've received so far. So our winter campaign is planned all the way through to the end of March, and it's going into market this week, actually. And we're working on events like Kingstonlicious, which we did last year, which of course can pivot to be takeout if we need to, but hopefully we won't.
Right. Okay. No, that's helpful. I mean, again, going on everything that I'm hearing, both from Kieran Moore and from Dr. Oglaza, is very much a desire to look at targeted restrictions where we're seeing spread. So I think that's again, obviously we'll see what if anything changes with the Omicron variant, but that's certainly the updated information that I have as well. That's great. Thanks, Allison. Karen, maybe over to you next from the chamber, just at a broader level, just in the business community. Would love to know what you're hearing and what you're seeing at your level.
Thank you, Mayor Patterson. I think the biggest piece for us right now is maintaining confidence for both the business owners, the consumer, and the employees that are out there. And I think that's the biggest challenge we have at the moment. With the news coming from public health over the last few days, the increase in requests has been significant for our rapid testing kit program. We are at a limit as to how we can operate on that program with a staff of 2 to accommodate the business community that we have as a whole. We are over currently 1,200 businesses who are taking part in that, and the inboxes are filling up minute by minute to get more kits. I did receive a shipment yesterday, so we are well stocked. It's just a matter of being able to push that stock out to the business community that is needing it. And again, I continue to thank the generosity of Brad French, our landlord here at the Alliance Business Center, for allowing us free storage on the main floor for those skids that keep arriving with kits. So it's really about the calls that we're taking here are about how do we get kits? How do I protect my customers? How do I protect my staff? How do I continue to stay open? How do I continue to try and drive my business during our peak period? And I've had a couple of communications through email with Dr. Oglaza on what some of those restrictions could look like. So we were trying to plan our best strategies around ensuring that we were able to support businesses with that. I would ask if anyone, we are going to put out a note to media today and through our social channels on asking if there's any volunteers out there that can help support us to open up more time slots to be able to push out more kits to business community. So that will be coming out. And on this note, if anyone is wanting to know more about the program, please go to chamberscreening.ca where you can book. We actually have people booking already into January 2022 for the slots. And again, we want to make sure we have enough out there for the business community during the holidays season when we're shut, because the chamber does shut down on the 24th for a week. So we're trying to ramp everything up. So that is my pitch for volunteerism to come support getting rapid testing kits out to our business community so that we can continue to be open for business. Thank you.
No, thanks, Karen. That's a great update. And just to be clear, because maybe I didn't catch this. Like you said, this is peak season for a number of businesses, certainly over the next couple of weeks leading up to Christmas. So do you have the volunteers and capacity you need over the next 2 weeks? I know you talked about planning into January as well. So is the call for volunteers really, is it immediate, or is it forecasted more into the new year, or is it both?
It's immediate. I have friends and family coming Friday and over the weekend. I spent Sunday here just getting kits and everything ready for this week so that we were able to push out as many as we could this week. So no, the need is immediate.
No, that's great. Thanks for that, Karen. And good to know that release is going out, and we'll help to share the word as well. That's great. Okay, I think I'm just scrolling through my phone here. I think we've gotten updates from everyone around the table. So thank you. And again, I just can't say enough about how I appreciate those updates. Whether you're sharing good news or not so good news, it's really, really valuable for me to be able to have that line of sight, certainly in advocacy and decisions that we're making. So thank you for that. So that's everything that I had in terms of the roundtable. I did want to just open up the floor for a couple of minutes to any updates from any of the working groups that people wanted to share with the rest of us. I know that's where a lot of the KERT work is happening right now. So would love to hear from folks on that. Trish, yeah, go ahead.
Well, I think all the groups have been talking about the development of communications and expertise with the workforce and employers and through micro-credentialing. So I'll leave that to some other groups. But one of the other things, not to do with COVID, in terms of the city's strategic objective to attract working people to Kingston, is that there's a target market with international students and students at St. Lawrence and at Queen's University, and starting to work on strategies that are very straightforward in terms of the messaging of we want you to stay, and people say they'll stay if there's jobs. If there's no jobs, they're not going to go. So how do we actually connect people with jobs and with career possibilities when they're in their final years of school? So it seems like that's an excellent target market because they've already lived in Kingston. And how do we go about doing that in a more overt, welcoming way to say, we'd love for you to stay here in Kingston, and here's how you can make a living here. So I think technology is going to help that, but also a strategic marketing and messaging to welcome people to stay here, rather than them thinking of this as a temporary stay. And we had a great conversation about the matchup between the employers and workforces and developing a dating app to get people actually just talking, rather than the job fairs that tend to be boring and not that productive, but really starting to look at technology in terms of matchmaking between employees and employers, and really collaborating in the training of the employees.
No, that's great, Trish. I couldn't agree more. The opportunities for dating apps and other sorts of technologies to connect people, I think, is the time has never been more ripe for that. It amazes me how often, I hear so often from employers about, can't find the right staff. And then I hear from so many people in the community that say, I'd love to stay here. I just need to find the right career opportunities. So I think that it's absolutely about that matching piece for sure. Thanks, Trish. Anything else from any of the working groups? Any other updates, information share? I know that there is discussion among the chairs, but I just wanted to give a chance if anyone else wanted to throw anything else out on the floor.
I think Mayor, the advocacy and funding group is kind of on hold till we learn from the other groups exactly what they want to be advocated. But I think our group is anxious to start thinking strategically about how they can help the other groups.
Okay, no, that's great, Pavna. And yeah, I think that makes a lot of sense. And I know that the chairs are meeting. I know that was one of the things we'd identified as a need to kind of information share among the groups. So are you finding that structure is sufficient to try to give the funding and advocacy group that information, or is there something else that you think we need to be looking at to share that info?
We haven't had a lot of feedback yet, so I think I know Abba's about to speak, so maybe we'll find a better way that we can activate them in January. But yeah.
Okay. Okay. No, that's great. Yeah, Abba, go ahead.
Oh, sorry, I was just going to say, so we merged the workforce and the underrepresented group together. So now it's the systematically excluded group and workforce group. And I think similar to what Tricia is saying, we are looking to find a way. We have a couple surveys that we're asking to be sent out to kind of identify from both employer and employee what are things that may be missing. So that we can have the toolkit to try to provide those insights, and then we would be able to better advocate or kind of say where it is that we need that advocacy. And so just kind of trying to get that information from the people that we need and we're trying to serve, and then using that as a tool to figure out what the next steps are in terms of providing resources to do so.
Oh, thanks, Abba. That's great. Craig, I see you've got your hand raised as well. Feel free to jump in on this.
Thank you, Your Worship, and I apologize. I'm a few minutes late this morning. We've got a big announcement later this afternoon and had last minute details. But actually, it's a really good example. It's an announcement. As long as you promise not to tell anybody, we've got a good news announcement out of the airport later today. But it's a great example of some of the challenges we're faced with, and I've heard that sort of theme here this morning is how do you plan for the future when the future is literally like an hour from now and the future changes hour by hour. And again, planning to bring in more connectivity to the rest of the world is obviously a good thing from an economic development perspective. It brings tourists here, which fill our hotels and our restaurants. The challenge, of course, is everyday changes with respect to new variants and other required limitations. So again, we're planning for the future, but being cautious about the present. Certainly not to build on actually all of the comments from this morning, which I've been furiously taking notes. A couple of things just to sort of update you on what my team is up to at the city, and I'll keep it at a high level in terms of themes. But obviously, workforce development is huge. One of the good news, and maybe it wasn't something that people caught within the budget process. It was a long 3 nights, but we did get significant funding to support family physician attraction. And that is already underway. We've got leads on 3 already, and we haven't even launched the program yet. So it's been an irritant, a major problem for many who have been without a family doctor for a long time. It is a barrier to attracting new people to our community, and is something that we're going to be working really hard on in the new year and launching some exciting new programs. But further on the workforce development sort of space, the disruptions that are COVID related are certainly significant, but one of the things we're paying a lot more attention to, again, is the disruption, the demographic changes that are happening, and the acceleration actually that's being caused by COVID. So, there's all these baby boomers that are retiring and have started to retire and will for the next sort of 6 or 7 years. That is a very profound labor market disruption. It's being accelerated. People are retiring early, it seems, from the data. People who are close to retirement or could retire, and COVID has just sort of pushed them to say, I've had enough, I'm I'm going. So, you know, these kind of fairly significant changes, exits out of very talented, very experienced people from the workforce is obviously, you know, a big issue we're dealing with. To Pavna's comment about the advocacy, you know, one of the things we are noting, and you know, some good news numbers. We haven't got the year finished yet, but I think the city's over $19 million in grants this year. That I think is a record. We're still waiting for 6 or 7 million to be awarded, so we're fingers crossed. Hopefully, we might hear before end of year. But we've already got almost $11 million in grants in development already for next year. So it's a very healthy pipeline. Some obviously relate very much to pandemic recovery and sort of growth of our community, economic development, but some are sort of across the spectrum. The piece that I think we're going to be doing a lot more focusing on from my group is the advocacy piece. And I'll just share an example. We've had a success just recently, and we didn't get the money yet, but we got invited to apply for a grant. And it's an exclusive pot of funds. I didn't know these existed, but I'm glad we got invited. But the reason we got invited was because of our success of a previous project. So this was a bureaucratic invitation from a ministry saying, we love what you do. We want you to apply. Why don't you come up with a project and apply for this funds? And there's only a few people applying for this. So I think we have a pretty good shot at the money. But again, part of that is that public service advocacy that we've been doing. I think there's a lot more opportunity there. And it's something that, again, with all of your collaborations, I think we can turn up that dial. Certainly politically, you know, we are entering the provincial election cycle. It seems like we always are in the cycle, but I would say there's probably a pretty strong need to hit that audience and make sure that we get you know, a strong share of resources and allocations, because I assume the money is the announcement's going to start pretty soon into the new year, and we want to make sure we get our share. The only thing last I would just sort of comment on is, you know, one of the things that we've seen and had great success on over the last 20 months is the cross-organizational collaboration that we've seen. And this call is an example of that. But one of the things we want to see is, how do we build structures or processes to make sure that continues? It has borne incredible fruit, not just immediate, but, you know, I can see the long-term outcomes that will continue into the future. But how do we create? And again, it doesn't always have to be meetings. We all have too many meetings as it is. But how do we create mechanisms to ensure that cross-organizational work continues? And again, it doesn't have to be everybody. It can be small groups. But that's something that I'm doing a lot of thinking on right now. And one other thing I did circle on my paper, we're also paying attention right now to building more sustainability for social enterprises, and several have commented about how they have borne an incredible burden over the last 20 months. How can the municipality seek some resources for training, for support, to build the capacity or maintain the capacity of that vital sector? So we'll be reaching out in the new year, Pavna, probably to you very significantly, but understanding how we can help some of your organizations that you support build their capacity. And we've had great response from Queens and St. Lawrence about potential training programs and other sort of resources that they might make available. So I've talked too long already, but I just sort of share that with optimism and excitement for the new year.
No, thanks, Craig. That's a great update. I think that the group really appreciates hearing all the stuff that the staff are working on, and so being able to push some of these priorities forward. I think a discussion on, you know, for example, some of the legacies that we want to come out of KERT, I think is going to be something we really want to focus on early 2022. And that cross-organizational collaboration, I think, is a good example of that. So Craig, maybe if we could, you know, even just bring a couple of those pieces, even if we have like a draft, and kind of bring it back to the group just for discussion and feedback in our next meeting in February. If it's possible to do that, that would be amazing. for sure. That's great. And thank you for that feedback. Are there any other questions, comments, either for Craig, for myself, or for each other, any other issues that we wanted to raise? I know that everyone's busy, and I'm not sure we all have 1,000 other things to do with our time, so I want to be respectful of that. But just while we all are here, is there anything else just for the cause that we wanted to raise? Yeah, Pavna, go ahead.
I know it's not directly related to economic recovery, but I wonder if another piece, I know the collaboration is something certainly in the social service sector we've acknowledged we cannot survive without it. And it's not just social services amongst themselves, but bringing in healthcare and government and everyone else. But one that we haven't as a group touched on, but it did come up in the brainstorming session we had with Eric, was climate change. And I know that's top of mind for a lot of people. So I wonder if there's something we can build into our economic recovery that supports climate change for all of us. Just a thought, just thinking out loud.
No, absolutely, Pavna. And I know that certainly, a lot of our focus, and the good news is there's a lot of action right now in the sustainable manufacturing space. And this is something that quickly is becoming a real key sector for us, and we're getting a lot of interest on it. So, but I think you're right. There's absolutely space for that, no question. Great. This is the first time I've ever done an entire meeting on my phone. So you guys have been very patient with me, so thank you. But there's only 4 screens that fit on my phone at once. So I have to keep scrolling back and forth to see everybody's smiling faces, make sure that I'm not missing any other hands. So, so thanks, folks. Really, I know I've said this before, but I'm going to say it again. I just so appreciate all of your time and all of your efforts. And as we're going up, one more twist on the roller coaster here with COVID, just appreciate everybody's perspective, the info, and how we can continue to work together. I think when it comes to uncertainty, which I think is what we're all facing right now, I think communication is a big part of that. So by all means, let's stay connected as needed, especially over the next few weeks. And if we need to connect on anything in the interim, we can do that. Otherwise, we'll look forward to gathering together early in 2022. So I think with that, folks, wish you all the best over these next couple of weeks and then into the holidays as well. And also wish you all the best just with time, hopefully to rest and spend time with your families and be able to recharge for what I know is going to be a great year, a much better, more exciting and a full year coming in 2022. So thanks, everybody. Great to see you all, and we'll chat again soon.